Well, good morning, listeners. It's Friday. Boy, don't I love Fridays. The program is Uncommon Awareness, and I am your usual host, Dr. Lorraine Hurley, www.drhurley.net. And today is today is our launch of something called Evolving the Species. This is a roundtable forum or discussion, and I'll be explaining a little bit more about that. But I have, actually what I am is more of a moderator and facilitator for this program. Your hosts for this program, really, or co-hosts, are going to be Dr. Dean Lloyd and Ann Rosen. And today I'm going to give some biographies on them. We will shorten it up in subsequent programs. It's going to be the second and fourth Friday of every month. And we bring on different guests, but Dr. Manrique is with us here today. Good morning, Dr. Manrique. I am going to, I'm going to give everyone's bios, and then I'm going to do a little introduction, and then we're just going to kind of take it from there, guys, okay? So I want to let people know who you are. Ann Rosen is philosopher extraordinary, and he's one of the most original thinkers of this or any other century, and he's an adept in the healing arts. His 30-plus-year practice as a health consultant led him to perceive firsthand the multi-dimensions of disease, discomfort, fear, and confusion which currently plague our world. I think a lot of us can identify with that. Culling from the best of his ancient futuristic pilgrimage, he has created a workable approach to harmonizing the mind-body connection. He has synthesized his many years of experience into a uniquely humanistic approach to life, love, health, and the true pursuit of happiness. For more than 3 decades as a professional health consultant, he has helped many people to achieve greater mind-body integration, facilitating inner clarity, vital health, and personal satisfaction. One of his mottos is that pleasure guides your way to health. Ooh, did you hear that? Dr. Dean Lloyd is a lifelong professional musician that has been practicing holistic healing for more than 20 years. He's a board-certified acupuncturist, naturopath, radio show host, author, professor, inventor, and philosopher. Dean uses his combined training in Oriental medicine and cross-cultural music theory, and this led to, his cross-cultural music theory led to the rediscovery of the role of the pentatonic scale in Chinese healing and his creation of the Accutone technique. Dean teaches Accutone to acupuncturists and health practitioners and has invented numerous musical healing devices, including the resonance bell, which he employs in his busy clinical practice. Dr. Manrique practiced as a doctor of Oriental medicine in New Mexico until he retired 2 years ago. He specialized in the integration of traditional medicine with modern functional medicine. Dr. Manrique utilized conventional lab work, imaging, physical exam, methods along with tongue and pulse diagnosis, and his skills as a medical intuitive in order to better understand the deeper causes of his patients' complex illnesses. He utilized many therapies, including oxidative medicine, bioidentical hormones, chelation, prolotherapy, neural therapy, physical medicine modalities, acupuncture, nutrition, Chinese herbal medicine, counseling, and Qigong. He's currently focusing, gentlemen and listeners, I'm so sorry, I've got this frog in my throat like yesterday. He's currently focusing on his passion for Qigong, different forms of meditation, and other ways of improving wellness and quality of life. And I'm going to skip myself. You guys hear me every day, but I did have a little bio for myself. I kind of want to get down to things here. Evolving the Species is a new forum. Our overall intent is to draw various practitioners of the healing arts into a dynamic conversation that leads to a better understanding of what it means to be integrated within body, mind, heart, and spirit. Many practitioners of the healing arts, not all, but an overwhelming majority of us, go into the health and healing arena because of our own need, our own brokenness. Though for a lot of us, this is a sub or unconscious drive. We don't realize that our desire to facilitate others into health is a projection of our own needs. So failing to see this, we become convinced that the tools, the art, the practice, or skills we develop are the vehicle of healing. We lack certain necessary insights into the overall process of true healing as one of profound and inspired evolution of awareness and consciousness. We, the practitioners, can only function effectively in direct proportion to our own level of consciousness as it pertains to health, wholeness, and what it means to be a fully actualized human being. So in other words, we can't teach others to ride a bike when all we're riding is a tricycle. This has become very obvious to those that recognize the role of consciousness or awareness in determining the overall quality of one's life. So the intent of this forum is to facilitate the integration of us, that we might then assist others with the clarity and compassion that is required for true healing. In other words, listeners, this forum is an attempt at transparency as we, the practitioners, kind of muddle in our own stuff. Dean and Am are uniquely qualified to facilitate this integration. They've done the work. Now, through a question and answer forum, we will begin to open ourselves up and see if we can't come out of this a little more awake and aware than when we started. Good morning, everybody.
Good morning.
Hello.
That was very long-winded. And listeners, at this point, I'm going to turn this over to Dean. And Dean, you can turn this over to myself or Dr. Manrique or Am as you see fit.
Beautiful. Thank you, Lorraine, and you did very well. Even the way your throat was working, or not working.
On the break, I'm going to go drink a gallon of water.
There you go. Good morning, Am. Are you there?
Oh, indeed I am.
Good to hear your voice. And Martine, are you there?
I am here, Dean. Good morning. Good morning.
Good to hear you. I'd like to start the topic, discuss a little bit about this. We're going to be talking today about what is detoxification? What does it mean? How does it work? What's the purpose of doing this? And to start it off, I'd like to ask Martine, what is it in your eyes? What does detoxification look like to you? Is it fasting? Is it having medical food shakes? Is it having herbs? What does it look like?
Well, Dean, detoxification is getting rid of anything that does not belong in your body. There's two general classifications of toxins. Those are exogenous, things that come from the outside, from the environment. For example, heavy metals, could be, carbon monoxide, and things that are endogenous or produced by the own body. And, we can just look at those and classify them in those two general categories. So removing anything that doesn't belong in the body and normalizing the systems of elimination and the systems of assimilation and digestion, so everything's in balance in the body.
Mm-hmm. And in your view, Am, can you just elaborate a little bit on that?
Well, yes. I mean, that's a good description. Basically, metabolically, we're a transportation system. It's a flow-through system. The better things flow, the better things function. Anything that interferes with that flow is going to throw the metabolic system off. On the physical level, as Martin said, it's if you build up something that doesn't belong in the body, it's going to block that transportation. It's going to stress the tissues in whatever organs or glands are involved. It's going to keep the body from functioning. It's going to cut down oxygen supply. So the body will be straining. That's just in general. Hopefully we're going to get into this a little bit more particularly.
We are indeed, because we haven't, in our profession, we've got a lot of, let's just say, fakey kind of detoxification that's going on there. It's not really clear what is being detoxified and what's the purpose, although, there may seem to be a lot of very obvious symptoms. For example, when people come, they said, we've just had these fires recently, and the air quality has been terrible. I live in Colorado, and we have a real dry spell here. We've had it for several years, but the environment is one where the fires are very, people are afraid of their area, becoming susceptible to fires because of the mountains, the trees, and the ground is just, perfect for this kind of situation. But breathing in that air, there's an obvious, relationship to allergies, and people have headaches, and they've even left the area because the air is so bad. But it came and went, and things are better now. But what if we were to think of detoxification or looking at the symptoms of this, someone who becomes exposed to it? Martine, would you give me just if you were to just say, oh, that's a toxic symptom, or that appears to be something that, you know, you're dealing with that symptom because you've got toxicity issues. What do those symptoms look like?
Well, in general, anything that has to do with pain, discomfort, the usual signals that the body will give the person that something is not working right, all types of pain, you know, joint pain, low back pain, headaches, sore throats, you know, those are the usual symptoms, as well as malaise, overall fatigue, lack of energy, unclear thinking, and the list will go on. And, you know, it depends on the degree of toxicity of the person, depends on how chronic the toxicity problem is or how acute it is, whether it's a recent ingestion of a toxin or is long-term. And anything that the body will just be uncomfortable with will produce a symptom. Sometimes we just don't pay attention to them, and sometimes we just suppress them, as with, for example, pain medicine. And we take aspirin, we take other pain medication trying to handle what appears to be the problem, and the problem really is much deeper, and the symptom is really just a signal that something has gone wrong.
And Am, would you give me a little bit on the emotions that are stirred up by detoxification? Does it happen commonly, and what does that look like?
I'd love to, Dean, but I'd love to continue the thought just before we get into that. For me, the cardinal rule is input-output. In other words, if the amount of nutrient energy coming into the body matches the output, then you keep a balance. That's if you're in balance to begin with. If not, something has to pay for that expenditure of energy. And inadvertently, in the body trying to keep up with the demands of our will, how we think we should be, and the activities we put forth under that, we wind up borrowing from one organ or gland system, one tissue system, to feed the demands of another, and that just furthers the imbalance. Now, you were talking about the fires and the smoke. That's a good example. If the lungs are strained, and there are different times of the year, different organs, as you very well know, become accentuated in terms of their function, what they have to do, what the body's going through according to the climate and the season. But I hear the music just about.
That's right, and the music means that we need to take a break. Gentlemen, the breaks are 5 minutes. I did send you a schedule, did I not, Dean?
Yes, I just got it.
Yeah, okay. So we do have there's scheduled breaks. Listeners, you're listening to Uncommon Awareness, and today's forum is called Evolving the Species. Our guest is Dr. Martine Manrique. We have Am Rosen, Dean Lloyd, and of course me, your host, Lorraine Hurley. Okay, we're back. We're back. The program is Uncommon Awareness, but today we have a special, twice a month, the second and fourth Friday of every month. We're going to be doing a roundtable. And our guests today are Dr. Martine Manrique, Am Rosen, and Dr. Dean Lloyd, and of course myself, your host, Dr. Lorraine Hurley. But Dean Lloyd is actually hosting this program. So, Dean, I'm going to turn it back over.
Okay, thank you, Lorraine. Am was talking about, before we left, the output and input.
Well, the input.
The emotional output. I'd like to focus on that for just a moment. And in this instance, when we're talking about detoxification, Martine, are you acutely aware of patients that are going through these places where they're not getting enough nutrition, they're not getting enough emotional support, and here you are in a position where you've got to make a decision, and you have to say, okay, you're ready to detoxify. What does it look like to you to support them emotionally, or is it more important to, realize that when they're going through a detoxification, they're going to be stirred up more emotionally? What is your experience with that?
Well, I'm glad you brought that up, because I think that in addition to the physical toxins that we have talked about, heavy metals, gases in the atmosphere, toxins produced by pesticides, all those things, we do have an in my opinion, we do have mental and emotional and spiritual toxins. And those things are important to consider in any detoxification program. And as a matter of fact, whenever a person does one of the basic things to detox, which is to modify their diet and to avoid certain foods, some people even go the next step and fast. They just consume water or juices. Lots of people report being in a bad mood. Lots of people report being, uncomfortable, and it's just because they're releasing emotional toxins, and that's part of the detox process.
Mm-hmm.
That's very common.
And Am, did you want to say a little more on that?
Well, sure. It's a very important point. What you do to the body affects the emotional processes through the feelings. How you mentally emote affects the body through the feelings. The feelings are the conduit. We talk about gut emotions because regardless of what you think or believe or what you avoid thinking about, everything you feel affects your physical body. It creates tissue disposition through the visceral organs. Now, the thing is, most people are oriented to, they don't stop. I'm just going about my business, doing my thing, but all of a sudden I've got a pain or a shortness of breath or I'm fatigued. And of course, if you can't connect with the world, if you lack the vitality, then you feel stuck. The world seems to be passing you by. You can't participate. This depression, this feeling stuck, can exaggerate your sense of not connecting, and it will also put inadvertently more stress on the organs. A lot of people wind up in negative recycling things where the depletion of the body's vitality leads to feeling distortion. And the feelings then, I don't feel good about myself, I'm trying to overcompensate, suppose I can't, lead to problems in the body. We kind of lock ourselves in. Most people don't realize they're doing that. Now, this is not that hard to get out of if you understand exactly what's going on. But different organs in the body, if you look at the functionality of an organ, what the liver does, what the stomach does, what the kidneys do, what the heart does, you'll see by the nature of how they function metabolically, there's a corresponding emotional state. And it's kind of fun to do that because you start to be able to read yourself better. But for most people, the body is something they kind of dress. They make it look good, put the right clothes on it, wash it, scent it. But most people are strangers to their own body, though it's the thing that they inhabit from the time they come into this world until the time they leave. Now, I hope we're going to extend this a lot, but we're talking also about detoxification. A lot of times, people, when I see someone, I can see that they need to detoxify, but I also have to assess whether their body is strong enough to handle the detox, whether their lifestyle, they may be caught up in things, will allow them, because you have to get off of the outer treadmill of activity to some degree and give some of the energy you would use into that outer activity that everybody's involved in back to the body so that it can heal.
Okay, we're taking another break. Again, 5 minutes. Listeners, this is Evolving the Species, a new forum that we're undertaking, and we've got Dr. Dean Lloyd, Am Rosen, and Dr. Manrique with us, and we'll be right back. Thank you for being with us. Okay, just wound our way through another 5-minute commercial break, and we're back on. This forum is called Evolving the Species, and we have Dr. Martine Manrique, Dr. Dean Lloyd, Am Rosen with us today, and I, of course, am your host, Dr. Lorraine Hurley. So why don't we just pick up where we left off? Listeners, we're discussing detoxification among us. Go ahead and pick up where we left off, Dean.
Thank you. And Lorraine, you've had experience with this in practice, and Am just mentioned that you have to consider if the body is strong enough to go through the detoxification process. I would like to ask you, how your attitude has changed from when you started in, seeing patients. Were they emotionally stable enough? Maybe you had considered that. What has changed in your view of why people need to do this? Start out with the treatment and the target symptoms, like reducing pain, better sleep, emotionally charged. What was your change from beginning to now?
Okay. Yeah, when like Dr. Manrique, I was certified in functional medicine. And when I began, I'll just simply say that it was basically just a physical process. It was about basically unloading, reducing the total load. And diet and nutrition was a big part. So I developed a course called First Steps to Health for Life, and it was food as medicine, heal your gut, support the organs of detoxification. Pardon me. And then we would, I actually taught a raw foods cooking class. And over time, when I began to do this, the more I did this, the more I began to recognize the emotional component, the psychological component that was really at play here. Don't believe I had an appreciation for how much emotional attachment people had to food, or how much self-image was really tied in with whether or not they perceive themselves to be healthy or unwell. So how has it changed? Today again, pardon me, it evolved to where I really began to appreciate, like Anne, that there is certain, that it wasn't a one-size-fits-all. And when I began, that's what I was doing. It was kind of a one-size-fits-all. This is what you do. This is how it's done. And over time, I really began to see that a lot of people needed to be, as Anne was saying, supported. First, they needed to just get off the toxic foods, maybe start taking some supplementation, maybe really begin to practice some self-care before we actually undertook anything that was as rigorous as a really full-scale physical detoxification. And, now, back in January and February, I sent out a newsletter where, the last component was really, truly acknowledging the need to detoxify emotionally. And so that's how it's changed for me. I hope that answers the question. I don't want to take up too much time describing this, but it evolved, and where I am today really is what I realize is that if we support the psychic and the emotional person first, they then have a greater chance of succeeding at the more rigorous physical steps that are required. So I look at it a little backwards today, where I make an assessment as a person. Of course they don't want to be sick, but do they want to be well? And that's an important.
Let's wrap that up.
So,
and Martine, that's kind of the challenge that we were talking about yesterday, is preparing people for this challenge, and even in a mild way, convincing them that this is even important. So what kind of people should detoxify in your mind?
Well, Dean, I think that everybody can benefit from detoxification, be it physical or emotional, spiritual toxins. And like Dr. Hurley was saying, it really boils down to how much do they really want, or how much, do they really want it. In fact, in my practice, I always had what I call a preliminary assessment visit. I never took a patient unless they went through that visit first, and that visit was had a twofold purpose. The patient could find out more about me, what I was about, what kind of things I could do for them, practical things like cause of therapy and things like that. But it was also for me to find out if that person was really, really willing to go through the process of taking personal responsibility for their health and willing to do what it took to get better. I wanted the patient to have as much into it as I did, and I was very, very involved with my patient's care. So, if they're not interested, they're not going to get well. So, on the other hand, we want everybody to be willing to accept the level that they are at now, and if they want to reduce weight, feel a little better, they can start with the basic things. Like Dr. Hurley was saying, avoiding the bad foods, adding good foods. And that's a simple way of fasting. You can just start by eliminating certain foods from your diet for a period of time. couple of days, and that's a good start.
And Nam, I know you want to jump in on this because when you identify where a problem is in some blocked tissue and relating it to where the emotional components are, in the body, it's kind of interesting because our Western culture has not been very keen or clear on how organs related to these emotional patterns. In Chinese medicine, it's simplistic. We can target the liver, for example, which is more emotional anger. The heart is joy. If you don't have enough joy in your heart, then your heart fails. Your lungs are grief, and so on. What would you give me some input on that? People, how you can target these blocks in detoxification.
Well, Dean, I developed a process which I'm very anxious to teach to other health professionals because I can only touch so many people. But most people are sabotaging themselves inadvertently. They don't know how not to. Most people, to paraphrase, you can't serve two masters. You can't serve both fear and understanding. And you have to ask, well, who are people, who's the master? And for most people, it's their fear. Fear shuts you down. It constricts you. It makes you back away. It limits you. Fear makes it all right to suffer because suffering is less frightening than facing up to this misidentification in the psyche. Part of my job is to educate people. I'm going to tell them exactly what's going on, what we're trying to achieve. But I have to make them become aware that against their reason, their desire, even their better judgment, even if they've got all the scientific validation intellectually, they're still quite often trashing themselves. They don't want to. You wouldn't wake up on a nice day and say, gee, the sun's shining, there's food in the refrigerator, rent's paid for a year, or the mortgage, whatever, nobody's out to do me harm, what can I do with myself? I know, I'll spend the day aggravating myself, worrying myself, frustrating myself. Wouldn't choose to. But often we do that. Since we don't consciously choose to, it's counterproductive to everything we want, but we're the ones doing it to ourselves. You have an irrational, subconscious part of the mind fighting against the rationality of the mind. And as I said, regardless of what you think or avoid thinking, your feelings are what control the physical responses in your body. Everybody can be patting you on the back and telling you you're God's gift to the world, but inside you can be giving yourself an ulcer or affecting your organs, creating tissue disposition where diseases can take hold. Part of the detoxifying is not just detoxifying, it's good, let's kick out the jams, but that means the system was thrown out of whack, metabolically and emotionally, and you want to regenerate the system. You don't want to just say, okay, I won't put the bad stuff in. It's like if you have a car with a fine engine, but you put the wrong grade of oil or gas in the car, and it gums up on you. You can't say, okay, I better put the good stuff in. Before the good stuff can really work and be effective, you're going to have to rebore, realign, and reset the timing. So and detoxifying is a start. There are things in the body, as it was mentioned, that are counterproductive, that don't allow the body to function well. But what will allow the body to function well? And, of course, then you bring in the feeling body. Most of our feelings are simply how we respond to stimulus in any given moment. Between not being able to respond to something because you may be so shut down, so inhibited, no, I can't go there, I can't look at that, I can't let myself feel that way, or having full access. You come and go, mix and match to your heart's content, or leave it alone. Most people, against their desire and reason, are functioning in a very repressed level. That's playing out through the body. It's a fear. It causes a sabotage mechanism. And I'd love to explain exactly where this comes from. Getting somebody out of it, and I mean permanently, non-regressively, is the task. Once you do that, once the body once the feelings no longer need to derail you, then with the right methodology, the body will respond even quicker. And one more quick point there is that there's a difference between getting away from a problem, you certainly want to get away from it, being it physical, emotional, mental, and moving towards a finer, more balanced, dynamic state, a dynamic state of comfort, which is individual to each person. We know these nutrients do this, we know this is a good system, but to heal somebody, to help somebody come into their own potential, you have to be able to see who they are, the mind-body integration, how they're oriented, how they've been raised, what they have to deal with.
Good point. I wanted to ask Martine in Access, because when we are realizing where people are out of balance, and they hadn't acknowledged that they had access to the deeper reserves or deeper balance in energy. They want to break cycles. We want to break cycles that are damaging them, that are hurting them, and when we detoxify, we are obviously bringing this to the surface. How would you, if you were to get someone to that point to where they're releasing these patterns, and for example, too much coffee in the morning, or getting to bed too late and not exercising, and all the basics. Once we lay the foundation, how do you go about rebuilding a patient? What's the mindset there? How do you do that after the detox?
You mean physical as well as emotional detox?
Yeah, in other words, after you've got them to that point, and Am's made these, he's pointed out that to restore balance, we've acknowledged that the physical piece, we can put people on programs that, here's your 10-day detoxification program, and once you come out of it, what does it look like to rebuild you?
Yeah, and let's let Dr. Manrique answer that after the break. We have to take another 5-minute break. Then we'll be back with just a few moments to wind down the first hour. We return at 6 past the hour for the second hour. Listeners, I hope you're enjoying this. I am. Okay, we're back on the air now. The program is Uncommon Awareness. Our forum today is called Evolving the Species. And Dr. Dean Lloyd had just asked a question of Martine Manrique, Dr. Manrique. What does it look like to, and I'm just recapping, Dean, what does it look like to support a client or patient who has just undergone the physical detoxification process? How does Dr. Manrique support his patient then in kind of moving towards what Ann was talking about, right? Is that what you meant, Dean, towards that greater satisfaction of life, now that we've got kind of the machinery cleaned out, where do we go from here?
And there's always these different levels to consider, but when there's some success in cleaning house, quote unquote, there's a de-emphasizing of foods that they were craving before, the detoxification, like no more wheat or chocolate or sugar or these kinds of things. What does it look like to rebuild somebody? Because you've cleaned house. How do you do?
Yes, thank you, Dean. Well, I want to go back to a concept that I think we have touched on, and I call that concept of vision of health and wellness. Whenever a patient came to my clinic, I did that initial interview to understand what their health situation was, what they wanted, and for me to, in a more technical way, develop a program for them to follow, which included, different ways of detoxification, fasting, chelation therapy, intravenous nutrition, and saunas, and avoiding foods, and adding these other detoxifying foods, and so on and so forth. Once that first stage of the program was finished, like the house has been cleaned, the gum has been removed from the engine, and so on and so forth, the important thing is to review or to remind the patient of the vision of health and wellness that motivated them to start with this program in the first place. Because lacking that, there is very little motivation, and it seems like in my practice, people start feeling really good and they have wellness, but they quickly forget. And one of the main frustrations that I had in my practice was to keep patients focused on what they needed to do and actually help them to undergo a life transformation. Because otherwise it would be me in charge of doing this, in charge of the help, and I was not comfortable with that. So once the patient has gone through the first stage of detoxification, you want to rebuild their energy reserves. Detoxification can be very demanding on the organs of elimination. So starting with nutrition, I always recommended adding foods slowly. We had a fast reduction of elimination of certain foods. Start adding foods slowly. Continue the exercise program. Continue with the other detoxification techniques that we use, like infrared sauna, for example, walking, exercising. There is a technique you're familiar with, Dean, called using ozone and steam and ozone saunas and things like that, to continue those at a more reduced level until it was time to come back for their next follow-up visit to start stage 2 of the detoxification program. So it was a combination of mental, emotional, psychological support, nutritional support to power up the mechanism, the organism after this effort to detox, and just come back for the next stage, because detoxification is usually very complex. The body is selective in how many toxins it releases at any one time, and it's really an art more than a science. We have to slowly convince the body that it can get rid of things, convince the patient that they can go through this process, and it takes a while. So somebody that came to me for detoxification, we would set out a program, and it probably could be up to a year long, depending on what their condition, initial health problems were.
And excellent, because it's a matter of overcoming what they've come to you for. If they're looking at it from a symptom point of view, I've been an insomniac for years, and I've never had any, success, and I don't want to take drugs, or I don't want to be, dependent on something, what we can talk when we come back is how do we do this? How do we overcome and integrate these changes?
Right. Very good. Now, gentlemen, this is a fairly long break, 6 past the hour, so if you need to go get a glass of water or do anything else, this is the time to do it. Listeners, we'll be back on at 6 past, continuing our dialogue with Dr. Manrique, Ambrose, and Dr. Dean Lloyd on detoxification. Thanks for being with us, and we'll see you in just a few moments. Welcome to the second hour of Uncommon Awareness. I'm the host for the program, Dr. Lorraine Hurley, and today we're doing our first ever roundtable discussion on this program. If you missed the first hour, I encourage you to go to get the archive, because we've kind of set the stage for what we're accomplishing here, and we have our esteemed colleague, Dr. Martin Manrique, with us here today. We have Dr. Dean Lloyd, and we have Am Rosen, philosopher extraordinaire. Gentlemen, before we continue, I just have to read you something that someone sent me over the break. It says, this is from a friend of mine, Ollie. When I took the entrance exam for medical school, I was perplexed by this question. Rearrange the letters P-N-E-S-I to spell out the part of the human body that is most useful when erect. Those who spelled spine became doctors, the rest are in Congress. Ha ha ha. I just had to lighten it up a little bit.
Absolutely. And I'm sure that with anyone who's thinking in terms of cleaning out, the Congress would be very well benefited by a detox program.
Oh, no kidding.
If we could pick up, I'd like to ask Am about what we've covered to this point, and we've wanted to establish a good foundation for what purposes of detoxification are. When we move into a higher place, if we're expanding our ability to have greater range of motion, easier, ways of moving in and out of spaces. That's very big in the healing. We have to realize that if we're moving into a stronger place, what is moving out of us? Okay, what is moving? If we're putting something that's better in us, right? If we're increasing the filament or the energy that we can take on, what is moving out? What's in the way? And I wanted to get Am's opinion about how we overcome and integrate these changes after we've done a detoxification.
That's a great question, Dean, but I'd like to take that in a couple of parts. By the way, for those politico aficionados, it should be known that emotional constipation does lead to psychological retardation. Anyway, I think it would be helpful if we look a little bit exactly, we're talking about detoxification, but we're still a little bit abstract. I'd like to nail it down for our listeners. Of course, we're just discussing this, and if anybody came to any one of us, we would be looking specifically at their needs. The art is individual application. But basically, as I said, barring assault or injury, there are two ways we imbalance the body. Either we don't give it enough to adequately perform according to our demands, or we put the wrong quality of stuff in it. Now, our bodies are genetically structured for self-repair. But when we do gum it up and you finally start to give it a nutrient that's been missing, it wants to go back and do what it hasn't had the wherewithal to be able to accomplish because it just didn't have the nutrient energy. But there are blockages we've established. And it's also important to inject that you have to consider the age of the person, not just the conditions, what they have or haven't taken in. Because as our bodies age, after 30, we move into a catabolic state. Before 30, we're predominantly anabolic, though that's slowing down in the 20s. That means we're repairing, we're building up new cells, we're repairing faster than we're breaking down. But once we hit the 30s, then we start to shift. We lose growth hormones. And the growth hormones have a lot to do with how effectively we can repair. Now, when the body, you give it something it needs, if we look at the organs of elimination, you have the liver, which is the main detoxifying organ. Seesaws off of the thymus gland because if you have too many toxins, it can lead to inflammation, and that calls for an immune response. You have the kidneys. You have the skin. These are organs of elimination. But to get all the junk out, you have the colon, the large intestine. Now, for most people, that should be a healthy, fat, muscular opening. Things are just moving through. But you want to make paper mache, you just take a little denatured white flour and mix it with water, and you've got a binding paste, the kind of stuff a lot of us eat. The most sensitive organ in our bodies to emotional tension is the colon. And if you call somebody an uptight so-and-so, if they're uptight, you pick an ass, you pick the right place. Because when we're tense, if somebody jumps at you and surprises you without realizing it, you inadvertently clutch the colon. And then we're on the run. We have demands. We don't take time. We're putting wrong combinations in. So part of the detoxifying is making sure these organs of elimination are open, that we give them what they need to assist if they're clogged up, that we rotor-rooter them a little bit. And this is not to make a fad out of it. I usually suggest to people that twice a year, they take a little time out. You should enjoy your life. It's fun to party. It's you got to deconstipate the spirit every once in a while. But it's also nice to take some of that energy that you put out there and just give it back to the body so that it can complete its metabolic processes, and then give it those specific nutrients, those herbs that will help facilitate the organ function. Now, when you do that, you start to feel better. But again, this is an absence of pain, an absence of debility. But then we want to start to rebuild the body. And with that, a lot of times what's happening is inadvertently we're sabotaging ourselves. We don't realize it. But as I said, the feelings will control our tissue disposition, the activity of our visceral organs in the body. And a lot of times, the fear mechanism, which is something that it's time for humanity to grow out of, individually and collectively, the fear mechanism makes it so that if you get too good, too strong, too capable, too effective, the fear comes upon you. And there's a holdback. I don't want to look at things. This all affects the body. So part of it is to bring the body online. You feel a little bit better. There is a thing, it's a hangover from our religious, millennia-old religious orientation that says if you suffer enough, then you get to be redeemed a little. Unfortunately, it's always weighted towards the suffering side. That also comes from the fear mechanism that most people have not understood how to get rid of, and so they, I'm due for a little redemption here. I've really been through hell. Oh, I'm feeling better, but now that fear comes up, I better suffer some more. This is not stuff people think through. If they could think it through, they wouldn't have it. As I said, the subconscious is irrational. It's illogical and unreasonable, but it does affect our bodies. So right now we've been talking about getting away from the negative. The other side of health, my favorite side, is just how good can you feel? How safely and effectively can you up the ante on your physical vitality, your mental clarity, your stamina, your overall enhancement of your performance level? That's something we should get into, but I think other people should have a chance to kick this around a little bit.
Well, I'm glad you brought that, how good you can feel. Martine, I know you're the practitioner of the martial arts, and you practice what you preach. You do this detoxification. I wanted to ask you a two-part question. One is, when you do detoxify, what does it look like to you? What kind of things do you usually go through or adjust? And the second part is, how good do you feel afterwards?
Well, good question, Dean. In fact, I was contemplating that during the break. Detoxification it really is a very complex subject, and we get to the technical details, and it's also a very involving concept that we're actually putting it into practice. I think that what Am has just said is more than just removing what we don't want. The toxins, I think, is more important to add what we really want. What is it that we really want? Health and wellness, energy, vitality. And I think that that's more important. In my personal life, I'm, the concept of detox is more or less like an ongoing basis. I'm avoiding things that are just not good for me, trying to keep the diet and keep, my mental and emotional environment as healthy as I can. But, more importantly, I'm adding things that do help me to feel good, like Qigong practice, which is mind, breath, focus, movement, music, meditation, holding still and being aware of what my body is feeling, having an assessment first thing in the morning where my body is. Many times the emotions, as Dr. Rosen has said, emotional constipation really manifests in the body. So we pay attention to what the body is telling us, we can then get to the emotion. There's a form of Qigong called Chang Mi Gong, which is Tibetan Qigong, and basically it's holding certain postures that will put the body in a position of stress, and then certain pains will come up. Those pains are connected to emotion, and it gives us a very focused opportunity to process that. So I'm constantly doing this. It's really my lifestyle. I'm interested in learning more about who I am and having more of an integrated conscious awareness of all my abilities. So that's kind of like what I do on a daily basis. I take coconut water in the morning. Sometimes I drink a liter coconut water first thing in the morning. That's to prime my kidneys and to get my lymphatics going in the right direction. I do Qigong first thing in the morning, I take chia seed and I soak a few of goji berries in it, and I take chia seed, and then I have my large meal of the day of lunch, and then have a smaller meal later in the day. And in between, I do writing and other things that are just adding quality of life, feel-good things.
Excellent. And you said the key word there is lifestyle. Becoming healthy is not just, okay, it's, I'll do my detox and I'll do psyllium husks, or I'll do, watermelon fast, or these kinds of things. It's that, just as you pointed out, you wake up in the morning and you have a routine. We all need a lifestyle that facilitates these changes. Otherwise, it's just dabbling, and dabbling is good for some things, but what is it that's integrated in you, in how you are thinking in terms of what you eat, what you're doing to rebuild your system? So it is a lifestyle change. And Lorraine, before we go to break, I just wanted to get your little your take on, is your lifestyle been changed?
We are going to the break. Okay, we're back. We're back. Today's forum is Evolving the Species, and before the break, Dean, did you have a hard time hearing the bumper music?
I did. Sorry.
That's all right. No, it's okay. Just because I can have Alex make an adjustment if you need to hear it. So you were asking me a question.
Well, it was. We pointed out that the lifestyle is the change. It's when we are addressing the detoxification pieces, a very specific, regimen. You follow a protocol, whether it be a 21-day, medical food shake cleanse, a diet, absolutely, a rigid diet that has to be followed. Those are methods. But what we were talking about too, in that to become healthy, which is the goal here, is it not? To have a healthy attitude and our bodies are healthy. We're not looking at pain. We're not running away from diseases. We're moving into a stronger place. It's a lifestyle change, and I just wanted to get a little bit of your input before I go to Am on what has changed in your lifestyle as being one who knows about detoxification.
Oh, boy. Well, I'm just going to be honest and confess, for me, I'm not as disciplined as Dr. Manrique. For me, learning detoxification, the first person I detoxed was myself. And I didn't know I could feel that good. And in other words, I was not sick. I didn't have symptoms. I just undertook it. And so I was kind of living with half an awareness of what it meant to feel good. Because at that time in my life, it was, health meant the absence of disease. And of course, I was a traditional physician brought up in that model. And as I began to embrace functional medicine, it moved. And then what happened was that realizing that, of course, you can't maintain that program as a lifestyle. So you say, well, I feel really good. And, so I personally embraced a lot of the physical changes, the diet, and the exercise. And then over time, I grew to comprehend that my emotional body was, because I was struggling, I was challenged to maintain doing things that I knew were absolutely good for me. I would kind of go in fits and starts. And so that's when I had to really begin to explore. I was sabotaging myself. I knew what to do. And what was really hard was that I was working with other people and, their perceptions of me, because I looked healthy and so forth, and I took a strong interest in them. And I had this kind of secret closet life of going, holy man, why can't I just keep doing this? And so I had to, what it means to me today, and again, for me, gentlemen, it's kind of become reversed, where I have to attend to the meditation, I have to attend to the, checking in, the insights. For me personally, I have learned that if I don't attend to my emotional body, there's absolutely no way I'm going to maintain the choices I want to make in terms of caring for my physical body. So I exercise, I eat well, but really what's become a stronger focus for me has been the meditation, I'm a voracious reader and learner. And so I'm sometimes all over the map trying to ask myself, how do I access these greater states of consciousness and well-being, And it's like from both ends, whether it's physical or it's consciousness, they both meet in the middle at the emotions. So I have to tell you, as a lifestyle today, I am personally, and people don't look down on me for this, but I am personally really undertaking to understand that one aspect of my life, and it's become a dominant focus for me. So because I can't maintain the physical and I can't really embrace the consciousness unless I begin to really understand what this self-sabotage or this procrastination or this kind of, yo-yo type of and yet to most people, I think to most people, if you looked at my lifestyle, you'd say I had a healthy lifestyle. But for me personally, wanting to take it deeper, oftentimes I feel like the way I perform in my life is inadequate. Does that answer the question?
Well, you're learning, Lorraine, as we all are. And Am, I know you're listening to this and saying, I've got something to say on that. The key to balance is consciousness itself. And as we expand, go ahead.
All right. Well, yes, your true security as a human being, and most people do not feel secure, no matter how much they accumulate materially or in terms of status or position. Your true security is when you have control of your mind, not escape it, not deny it, not avoid it, not repress it. When you can move at will into your physical senses, that is the processes of your body, into your feelings, into your mental, your intellectual constructs, or
this is important. So instead of just, why don't we just kind of hold on to that? You just got started. We have to take another break. The next segment will be our longer segment, and then we'll kind of be winding down the program. Listeners, thanks for being with us. You're listening to Evolving the Species, a new roundtable. We've got Dr. Manrique, Dr. Dean Lloyd, and Am Rosen with us today. Thanks for being with us. All right, listeners, we're back. I want to thank you again for being with us. The forum today, the roundtable, is called Evolving the Species, and if you have missed any part of the program, I just encourage you to get the archives. And we're going to hand it back over to Dr. Dean Lloyd.
Yes, Am, you were just about to start.
Yes, and I'd love to continue that. Thank you. All right. So your real security as a human being, whoever you are, whatever level of development, whatever your inclinations, disposition, circumstances, your real security comes from understanding how to control your mind. Not suppress it, escape it, avoid it, but when you can move to your physical senses, into your feeling responses, into your conceptual intellect, to any degree or combination you choose, only for as long as you choose, or when you can remain openly centered in the moment, exquisitely aware without feeling automatically compelled to label it and emote about it, when you have that kind of control, you're given a chance to play, well, why not? You'll go for it. Because anytime you don't like it, you can change it. But if you don't have that kind of access, and it's something everybody can have and should have, but right now most people don't have, if you don't have it, then you're going to wind up bartering out of insecurity. Okay, I'll do this for you in this way or touch you in that way, but only if you do this for me in this way and touch me in this way, which kills the spontaneity. And this is all a product of insecurity. Anything that makes you, to any degree, whether it's a mild momentary annoyance or it's a full-blown, I can't get out of it, it's driving me crazy, I'm depressed and stuck, anything that makes you uncomfortable inside is never, ever anything more than a misunderstanding of how to more appropriately, adequately, and effectively deal with what you're considering at the moment. It's not bad, it's not good, it's not right, it's not wrong. It may do something for you at some point in your life. It may have advanced your cause and saved your life, but it's obviously not adequate for your needs now. to learn to be able to understand these different levels. Most people don't. They think about things. But thinking about things doesn't get at these, for what most people, we call them subconscious, because you feel, I don't know, man, I can't help it. It's just the way I feel about things. Yeah, you're making sense, but I still feel this way. What are feelings? They're patterns of response that were conditioned into you by circumstances, by people's attitudes, by what you inherited, before your intellect could really screen these things. When you're 1 or 2, you don't say, hey, Mom, Dad, all this stuff you're laying on me is kind of interesting, but, I need some scientific proof. I'd like some second opinions. Can we talk about this? No. You don't even have the intellectual skills to recognize it. You're born naked, dependent, helpless, and everything is doing unto you. By the time you can start to form a working sense of yourself, hey, I'm me, I'm a boy, I'm a girl, whatever, you have an intense 4.5 years of conditioning behind you, and you don't remember exactly what happened. You were locked into patterns of response. You were adapting and accommodating to what you inherited coming into this world. Then you start to question. You start to develop the ability to think about things. Well, I don't want to do it this way. I like this better. And your thoughts, probably not, but they may even be right on. But that's when you come into a war zone within yourself between how you've been set up to respond to things, to feel about things, and what you start to see as being feasible to you. Think of how much time, individually or collectively, we waste being uptight, picking on ourselves, aggravating ourselves, worrying ourselves, and how that stresses our body and distorts our perception and cuts us off from a deep level of intimate interaction if we want it. Now think of all that energy that we waste and hurt ourselves with suddenly was returned to you. It's still the same environment, same table, chair, dog, house, book, cat, whatever, but you're starting to experience it in a different way. Now think if you're not only wasting your energy and hurting yourself, but you're finding intelligent, and I stress that word, adequate techniques, ways of focusing and concentrating to bring even more energy into your body and into your mind. It's still the same table, chair, book, house, whatever, but you're experiencing it differently. I would like to propose to all of you that it's time for humanity to come into its own, to outgrow these primitive patterns, which are understandable. They're not wrong. They just don't serve us, especially with the brilliance that our technological innovation has produced for us. I call it the problem of space-age technology versus Stone-Age emotions.
Perfect. That's wonderful. I wanted to just say to the listeners that this may be new for you to hear for the first time, that what we're identifying here is the root of blockages, the root of our illness, the root of our dis-ease. That we talked about detoxification today, but these are all aspects. But what Em just mentioned here is that we have got to understand that when these feelings are blocked, they're not under our control, then we never achieve what it is to be in a true happy state or a balanced state. And I wanted to bring it around to Martine. Now that he's changed his life because he's out of practice, he's entering a new kind of place that is it facilitating what he wants, and he's moving into a stronger place to help others. What does it look like to you now that you've seen, you've changed your lifestyle? How have you interacted? How has it changed your lifestyle? How has it changed, and have you become more integrated as a healer and as a healthy person?
Thank you, Dean, and thank you for your thoughts. Yes, physician, heal thyself. And like Dr. Curley said, you can't be riding a tricycle and attempting to teach somebody to ride a bicycle. So I'm taking it to heart and putting it into practice or expressing the knowledge that I have within to recover my wholeness, which is really the only way that one can be happy and be expressing joy is to recover wholeness. And without going into too much detail, I believe that we're born into a artificial world with artificial thought patterns, artificial beliefs. We oftentimes call it the Matrix. And it takes a considered effort to regain one sense of self. Who are we? Who are we truly besides the thoughts, the feelings that run by our bodies, by the thoughts that run by our head? Who are we besides the opinions of others of who we are, the image, as I was saying, that we have been imprinted with since we were very young? And in fact, I can often ask myself, who am I besides the experiences of previous past lifetimes? I mean, who are we? Where's the continuity of consciousness, the awareness of self as an integrated whole being? And that is what I'm pursuing now, and that is what I'm putting into practice on a daily basis. And my lifestyle has changed. It changed in this direction once I acknowledged that I wasn't satisfying those things, that I wasn't really pursuing the things that would help me to regain wholeness. So what does it look like?
I'm sorry, I was just going to say that you did the first thing in any healing is you identified where you weren't satisfied, where it wasn't fulfilling you, what was wrong. And once we asked that question in all honesty, and you're earnest, you're taking the step into healing. When someone walks into my office and comes in and says, I need help, that's the most important piece in anything that we are dealing with in health. And Lorraine, I didn't mean to cut you short there, Martine, but I do know that there's some insight that you have into that. Can you share?
And some insight that I have into,
because your lifestyle, when you said to yourself, I'm not being satisfied. As practitioners, when we do this work, we get into a very mental state. And very often we're not trained to see patients on a whole level, although we say the words, things like holistic, have we changed, but we aren't whole people. And I just wanted to get your thought on that, how you shifted.
Oh, how I shifted, yeah. It was, again, I wasn't satisfied with I was doing all the right things, but there was a missing piece. There was something, and I guess what Martine has really described is that sense of wholeness. I had done, the way I look at it now, I guess I could say is I have really begun to, I see people differently. I see myself differently. I look at the world now, I say, everyone is doing the best they can with what they have. I no longer, I recognize that everyone is, first of all, entitled to their process, and second of all, there is no one process that will, there is no one size fits all. We can talk about it ideologically, conceptually, but the way it looks like in my life and practice, to achieve wholeness is, I think of words like integrity. I think of words like, being, Don Jose Ruiz, be impeccable with my word. The way it looks to me to be whole is actually to permit myself to make mistakes. It is to be honest, and to basically say to people, I'm on the path, I haven't arrived yet, but you know what? It's the deepest desire of my heart that we all get there. I have
the overcoming piece is it you've allowed yourself or given yourself the permission to say, I'm not dealing with what I want. I'm not getting what I want. And coming to that place of honesty. And that was what we were ending the last hour, is this overcoming piece. Could you give me just your closing thought on that? Could you tell me about it?
And we could probably go on with this for hours. Let me mention, and if anybody is interested, if you'll find this on the homepage of my website, the accordion section across the front. It's called The Geigers. They're also outlined in my newest book. But there are 3 of them, and they are psychologically impeccable. If you learn to adapt them and apply them, they will save you a tremendous amount of aggravation. But let me just mention the 3rd one in light of what we've been talking with. The 3rd one is you learn to make the best state of mind you've ever known Well, there it goes. But, all right, we have a break.
Yeah, we have a break. And just hold that thought. The third Geiger, we're going to come back with the third Geiger. Listeners, we're going to be winding down our program today. I hope you've enjoyed it. If you've missed any part of it, get the archive. And before we wrap up today, I'll make sure you have everyone's website and contact number. But in the meantime, sit tight, and we'll be right back. All right, listeners, we're back, and we just have a few moments left before we wrap up today's program of Uncommon Awareness and our forum, our roundtable forum today, Evolving the Species. And just so in case we get kind of cut off, Am Rosen's website is lifegame.com. Dean Lloyd's website is accutone.com. And Martine, do you have a website that I can pass on to listeners, or now that you're in retirement, is that something you've let go?
Right now, I'm being very low-key. I do not have a website.
Well, that's okay. I just, I wanted to toss it out there if you had one. I'm admiring your lifestyle as I listen to it. Anyways, the third Geiger. Let's just go ahead and put Am on with the third Geiger.
Well, thank you, Lorraine. All right, quickly, there are three of them, and they all feed into each other, and they'll always allow you to gauge what's going on within inside of you. But the third one is this. You make the best state of mind that you've ever known the least you'll accept. You don't confuse that state of mind with the person, place, thing, or situation that seemed to be there when you were going through it. Something might have catalyzed you into it. You went out on a date and it turned out to be the greatest, most intimate, wonderful experience of your life. Well, you'd like to repeat that. Well, what songs were playing? Where did we eat? How do we talk? How do we make love? Don't do that. If what you're dealing with is consciousness itself. You've known moments when you feel physically vital. You've known moments when your mind is working with amazing acuity. It's just so quick and clear. You've known moments when you feel full of sexual magnetism. You've known moments when you're so at ease that nobody can really bother you. If you don't confuse the state of mind you've accessed with what seemed to be going on, you start to create a biofeedback system. Then if you're going to relate to a situation, well, the least you'll accept is the best state of mind you've known. Anything that doesn't match up, you want to understand why it doesn't match up. How are you doing it? What adjustments do you have to make to allow you to maintain at least the best state of mind? And by mind, I mean body, which is a part of mind. It's a level of consciousness. And of course, anytime you find a better state of mind, that becomes the next least that you'll accept. It's a little more involved, but that's the gist of it. And I thought that it would be appropriate because we're talking about individual satisfaction, really becoming healthy, enjoying your life as much as you possibly can.
What a beautiful place to be able to bring a topic like detoxification to, because we are trying to achieve, all of us, the best state of mind we possibly can. And that's just a little segue to our show Dr. Rosen and I have. This State of Mind, Quality of Life is aired on Friday. It's 8 to 10 Mountain Time, 7 to 9 Pacific Time on Wolf Spirit Radio. And you can access...
That's PM, right, Dean?
Excuse me?
PM.
Yeah, 8 p.m., 8 to 10 p.m. Mountain Time. And we go over, we talk about a variety of things. Am and I were just talking about, do you want to just give a little preview of that, the next show that we're doing?
Well, we're doing a two-parter. We just did part one. A lot of people have been using marijuana for a long time, and most people really don't understand what's happening. So this was called not necessarily stoned, but beautiful, borrowing a lyric from Jimi Hendrix. The first part was the health of the high. The second part, coming up in August, will be the recreational pleasure of the high.
Excellent. And Martine, before we go, did you have anything else that you wanted to share with us?
Dean, so many angles. so many possibilities. I go from a full range of emotions to very detailed thoughts about, this concept of detoxification and practical applications. So I think that the most important thing that I would like to emphasize, as Am has touched on it, we have all touched on it, is a higher standard of health and wellness. And how does that feel? Once we have a sense of that, we integrate it into our lives, and that will drive us into better and more quality of life in the future.
Beautiful place to leave off. Yeah, beautiful. Gentlemen, thank you so much for being with us. And Dean and Ann will be with me the second and fourth Friday of every month. Our next topic, I believe, is biological dentistry and hormones, but with the same process. Thank you so much, listeners. I'll see you Monday morning. Ann, Dean, I'll talk to you later. Martine, such a pleasure to meet you. Thank you for joining us today.
Likewise. Thank you.
Enjoy your life.